زميلات والزملاء الكرام، السلام عليكم ورحمة الله وبركاته. رمضان مبارك على الجميع، وكل عام وأنتم بألف خير. أعاده الله عليكم وعلينا بالخير والبركة، وأعدى عنكم وعن عوائلكم كل سوء. My session now is regarding orthodontic treatment of adults, which is really, I consider it one of the most interesting subjects that we may face in our orthodontic clinic, especially there is a routine question asked by patients: can I do treatment if my age is 20, 30, 40, 50 years, or older or less than this age? So I try my best to answer this question. In general, orthodontists consider adults as those whose growth is essentially completed. However, the mean cutoff age for females is 18 years, while for males is 20 or 21, which is slightly later. Adult orthodontic patients can be subdivided into younger adults, typically younger than 35 years and often in their 20 years of age, and usually they desired but did not receive comprehensive orthodontic treatment at youth. They usually seek the maximum improvement that is possible as they become financially independent, as in this case of a female of 28 years of age complaining of procrastination of upper anterior teeth, and at the same time she has a deep overbite, and I started to intrude the upper anterior teeth, upper and lower anterior teeth, so that I can retract the upper anterior teeth backward and improve her aesthetic. Usually for the young adult orthodontic patient, the goal of a treatment in this group is to improve their quality of life. They may or may not need extensive treatment by other dental specialists, but frequently need interdisciplinary consultations. An example of that, this case, 32 years of age females attended to my orthodontic clinic. Her chief complaint was midline diastema, but at the same time she didn't notice that she had big lateral teeth and spacing in the lower arch. So I tried my best to close the midline diastema and provide enough space for restoration of the big laterals in the future, and at the same time closure of the spacing in the lower incisors. Another adult orthodontic patients group is an older group, typically in their 14 or 15 years of age. They usually seek to maintain what they have, not necessary to achieve ideal orthodontic results. The treatment needed to meet specific goals that would make control of dental disease and restoration of missing teeth easier. And here the orthodontics is an adjunctive to achieve larger periodontal and restorative goals. As you see in this slides, this is a 52 years age female attended to my orthodontic clinic. She complained of trauma from occlusion, procrastination of upper and lower anterior teeth, and midline diastema and spacing in the lower incisors, and she asked me to do whatever I can to improve her aesthetics. So I started my treatment to collect the spaces and get rid of trauma of occlusion, and finally I do restoration by conservative treatments. The types of orthodontic treatment for adults, either comprehensive or adjunctive. There are some points that should be considered during comprehensive orthodontic treatment of adults. That the comprehensive orthodontic for adults is the same as for adolescents, that require either complete fixed orthodontic appliance or clear aligner therapy, and sometimes intrusion of the teeth is likely to be needed, as usually done in adolescent. An example of what I've talked about, this case attended to my orthodontic clinic, her age about 33 years, and complaining of collapse of upper and lower arches and crowding of upper and lower anterior teeth with anterior open bite. I recommend the use of Demon system, as you see, placement of the fixed appliance from 7 to 7s, so I include all the teeth as I said, and I think the Demon system here can give me the maximum improvement of hair aesthetics, because as you know, the Demon system try to expand the upper and lower arch in very nice manner to improve hair aesthetics. Here in the comprehensive treatment, the orthodontic surgery may be considered to improve the jaw relations, and the most important thing that the duration of the treatment from braces on to braces off exceed 1 year. Most of adults receiving comprehensive treatments are main candidates for aesthetically enhanced appliances, as in this case, when she came to my clinic, she insisted on doing orthodontic treatment by using the aesthetically enhanced appliance, otherwise she can't withstand other type of appliance. The comprehensive treatment tends to be difficult and technically demanding, and the absence of growth means that the growth modification is not possible. During comprehensive orthodontic treatment for adults, the only possibilities are tooth movement for camouflage or orthodontic surgery, because as you know, growth modification cannot be applied at this age because of ceasing of growth at this period. Example of that this case, patient female of 32 years of age attended to my orthodontic clinic complaining of collapse of upper and lower arches, and she asked me to help her to improve her aesthetics, and I recommend for her the use of Demon systems, as it causes expansion, or very nice expansion of the arches, and at the same time I recommend from her to use permanent retainer for a long period of time to prevent relapse of the case in the future. And the application of skeletal anchorage nowadays broadening the scope of orthodontics treatment. Some patients who would have required surgery even a few years ago nowadays can be treated by using camouflage treatment only because of the invention of TADS. As you see in this case, she complained of procline upper anterior teeth in addition to deep over bite, so I place a TADS to intrude the upper anterior teeth, then I retract them to improve the aesthetic of the patients. For the adjunctive orthodontic treatment, usually it's carried out to facilitate other dental procedures necessary to control disease, restore function, and or enhance appearance. There are some rules regarding the adjunctive orthodontic treatment. First, it involves only part of dentition. As in this case, she came to my orthodontic clinic, her age about 52 years, and she asked me to improve her aesthetics, and I started my orthodontic treatment and placing the brackets only on part of dentition. One, that the primary goal usually is to make it easier or more effective to replace missing or damaged teeth. As in this case, a female of 50 years of age, she complained of crowding in the lower anterior teeth, and I started my treatment to retract the canines using TADS, and at the same time decrease the amount of spine present posteriorly to make the restoration in the posterior teeth more easy. The third rule in the adjunctive orthodontic treatment, that the treatment duration tend to be few months, rarely more than 1 year. And because of most of patients here in this group are older adult patients, so they prefer to shorten the treatment period as much as possible. An example of that, this case seen here, a female of 45 years of age attended to my orthodontic clinic, and she complained of midline diastema and extrusion of right central and lateral incisor. So she asked me to improve her aesthetic as much as possible and with less period of treatment. As you see, the case complicated by the presence of implants and permanent restorations in both upper and lower arch. So this make the treatment more difficult. I tried my best to improve the aesthetic of this lady by using the TADs on one side. So I start to intrude and at the same time start to protrude the upper incisors in the right side, and I reach to the final results. And the period of time talks about 8 months only, and she felt very happy about the result. However, the long-term retention of it is supplied by the restorations, as in this case, which is really the most difficult case I treated in my life. Her age is 61 years, and she complained of poor aesthetics, and really she said that please help me to smile as normal people, because I can't smile and I can't talk normally. So I started my treatment with placement of TADs and trying to intrude and at the same time collect the spaces and retract the teeth, upper and lower teeth posteriorly, and then finally I do restoration for the teeth, so that to improve the aesthetic and at the same time to retain the teeth in their positions. One of the goals of adjunctive treatment is to facilitate restorative work by appropriate positioning of the teeth, and also to improve the periodontal health by reducing areas that harbor plaque and make the control of oral hygiene is more easy. An example of that, this females of 52 years of age attended to my orthodontic clinic, and her chief complaint was the plaque triangle present among the incisors. So I tried my best to overcome that with a very short period of time by placement of orthodontic appliance only in part of dentition. I tried to collect spaces, and you see the end result that the lower incisors all aligned without the plaque, without the presence of plaque triangles. Also, we can position the teeth so that the occlusal force are transmitted along the long axis of the teeth and uprighting of the abutment teeth. As in this case, if you see that if you want to restore the teeth, here we need to upright the laterals so that the forces will be applied on the long axis of the tooth correctly. Also, redistributions of or closure of spaces, and this is most important during restoration of missing teeth. This is example of this case came to my clinic. Her age 25 years, and she lost her incisors by an accident, and she want to restore the teeth, but really when I examined the case, I found that the space presence is larger than the required one, and at the same time I saw that the upper and lower incisors are proclined. So I initiate my treatment to reduce the space presence and retrocline the upper and lower incisors so that I can get maximum improvement of hair aesthetics. One of the main problems that I faced during treatment of this case, that the patient recommended from me to restore the space present by temporary restorations, because it is very difficult for her as young adult females to stay with empty space. So I tried my best to use these teeth and fix them to the orthodontic arch wire so that I improve her aesthetic during orthodontic course, and at the same time encourage her to be fully cooperative with the orthodontic treatment. This is before and after. After finishing the treatment, you see the spaces will be less than before, and also I retrocline the teeth properly so that I can get maximum improvements of the aesthetic of the patients. A very important note as a general guide in treatment of adults with periodontal involvement and bone loss, usually the lower incisors that are excessively extruded are best treated by reduction of crown height. As you see, this is my case, and I need in some steps of treatment to intrude the or differentially intrude the lower incisor, especially the lower left central and lateral incisor. So here I did a slight reduction in the crown height, better than do intrusion, and to save time. The first problem that we face during treatment of the adult patients is the lack of growth. Although the growth continues at a very slow rate throughout adulthood, this means that there is no scope for growth modification in adult patients. So really this may reduce the chance for selecting alternatives of treatments. The second most common problem that we may face in treatment of adults, that usually the adult patients are more likely to be suffering or have suffered from periodontal disease. However, we must put in our mind that the reduced periodontium is not a contraindication to orthodontic treatment, and it's vital that any active periodontal disease is treated and stabilized before orthodontic treatment can be done. وبصراحة عندي حالات إن شاء الله أذكرها لكم مستقبلا اللي على هذا المجال اللي إحنا نركز بها إنه starting the orthodontic treatment must be delayed until we can control the periodontal status of the case. One of the possible managements of the orthodontic patient with periodontal disease, that we must use lighter force due to reduced periodontal support, and at the same time we usually prefer to bond molars rather than bond them, because as you expected, the control of oral hygiene around bonded molar is more easily than the bonded molar. Third point is that the retention at the end of the treatment needs permanent retention, and often in the form of bonded retainer. The third expected problem in treatment of adults is the missing or heavily restored teeth. First thing regarding to tooth loss, that may lead to drifting and or tilting of adjacent teeth, or sometimes over eruption of opposing teeth into the space. And this really make our treatment, which is mostly, as we said, adjunctive treatment that contain both of orthodontic and maybe conservative treatment, make it more difficult. So here you must overcome this problem and try to, for example, to correct the inclination of teeth or redistribute spaces so that you can make good restoration for the missing teeth. Also, the atrophy of the alveolar bone can occur usually, especially if the teeth were lost early age. So expected to see necking of the alveolar ridge and this make the tooth movement adjacent to this area is more difficult. Regarding physiological factor affecting tooth movement in adults, there is a reduced tissue blood supply and decreased cell turnover in adults. That means that the initial tooth movement may be slower in adults and may be more painful. So lighter initial forces are therefore advisable to overcome that. Otherwise, we may reach to teeth mobility or resorption of the roots or bone loss. Regarding adult motivation and attitude toward treatments, adults have the potential to be excellent, well-motivated patients, and physiological factors that suggest that the treatment may take longer time than in children. However, this is not always the case, and usually the increased cooperation really may compensate for slower initial tooth movements. بصراحة هذا الشيء الغريب اللي أنا لاحظته من كثير من الحالات اللي عالجتها اللي هم الادلتس patients، فشفت عندهم احترام كبير جدا للمواعيد، وكذلك الالتزام بالتعليمات اللي نعطيها بصراحة أكثر من الأعمار اللي هي الادolescent واليونجر ادلتس. فذلك اللي لاحظته إنه بالرغم ما احنا نتوقع إنه العلاج حيكون أطول مما في الأعمار اللي هي أقل منهم، لكن لاحظت أن العلاج كان يمشي بشكل excellent ومتعاونين جدا وريسبكت ابوينتمنت. وتفاجأت أنه في بعض الكيسز اللي أنا كنت أتوقع أنه مثلا تأخذ فترة طويلة، لاحظت أن العلاج وصلنا به في النتيجة جدا لطيفة وبسرعة غير متوقعة. مو كانت السرعة هي انه انا سرعت في العلاج بقدر ما هو كان التزام المريض بالتعليمات يعني وقت الحضور لأداء جلسة التقويم. وسأذكر لكم في مثال لطيف حاليا اللي هسه حتتابعوه على كيس اللي انا توقعت انه العلاج ياخذ فترة طويلة، لكن الحمد لله كانت النتائج لطيفة وسريعة وغير متوقع. Example to what I've talked about regarding cooperation of patient that may compensate for the longer treatment period expected in the adults. This my patient, 52 years age, females, attended first to my clinic complaining of what you see, and the most important thing I noticed that her periodontium is very poor, so I sent her to my colleague periodontist to control her periodontal problems. And after 6 months of treatment, she came again and started my orthodontic treatment. As you see, her complaints are midline diastema, proclination of upper and lower anterior teeth, and trauma from occlusion, and at the same time spacing the lower incisors. So I started my treatment with aesthetic appliance because she's prefer the aesthetic appliance, and at the same time I started to collect the spacing in the upper and lower teeth and retrocline the incisors and control the median diastema, and to get rid of trauma from occlusion. And when I reached to the nice result, I start to fabricate for her permanent restorations to improve the aesthetic of the teeth, and at the same time to retain the teeth in their position. So another case, which is her age about 43 years, and she complained of crossbite anteriorly, and at the same time she had postural class 3, and as you see she came with bridges in the posterior teeth. This makes the treatment really more difficult. I tried my best to overcome these problems, by doing expansion of the upper arch anteriorly and posteriorly to get rid of cross bites, and at the same time to overcome the trauma from occlusion. And I reached the final result, as you see, really unexpected result. And the treatment time took about 11 months only, unexpectedly, because the patient was very cooperative and respect the appointment, and at the same time the treatment continue in very well manner. Thank you, and I hope to see you in the future.